Transmission of the new coronavirus, which originated in Wuhan, China in late December, was declared a public health emergency in the United States on Friday. Some health officials suspect the Wuhan coronavirus may soon become a pandemic, which is defined as a health epidemic on two or more continents. Overall, there have been more than 70,000 reported cases in 27 centuries, along with more than 350 deaths, mostly in China. In the United States, there have been 11 cases so far, with the latest infections confirmed Sunday in a University of Mexico's Boston student, as well as 3 individuals in California who recently traveled to Wuhan, China. A new travel ban also went into effect Sunday at 5 p.m. EST, prohibiting non-US citizens who recently traveled to China from entering the United States. While this virus poses a serious public health threat, the risk to the American public remains low at this time, and we are working to keep this risk low. Health and Human Service Secretary Alex M. Azar said in a statement, "We are committed to protecting the health and safety of our Americans, and this public health emergency declaration is the last in the series of steps the Trump administration has taken to protect our country," he said. Though the risk is still low in the United States, health officials are working to understand how to effectively treat the infection. There's country no specific treatment or cure for the Wuhan coronavirus. However, there are some interventions already showing promise, and support care can relieve symptoms. Treatment with supportive care. Because we do not have a targeted treatment against the new coronavirus that's approved by the Food and Drug Administration, people who have contracted the coronavirus are treated with supportive care. Supportive care treats the symptoms such as fever, cough, vomiting, diarrhea, and fatigue, not the virus itself. It helps keep people comfortable while their bodies fight off the infection, according to Dr. Margot Savor, a practicing family physician and chair of family and community medicine at the Lewis Carr School of Medicine at Temple University. This can include medicine treatments to reduce the fever, cool baths, hydrations, and if necessary, respiratory support from oxygen to artificial ventilation, Savor told Healthline. Keep in mind that many people who contract the coronavirus experience relatively mild symptoms and are expected to recover. And in many cases, supportive care has been enough to get the patient back on track and avoid complications. This is an actual infection disease, and there are many mild cases whose recovery mimics that of recovery of the flu, said Dr. Amish Adalja, an infectious disease physician and senior scholar at the Johns Hopkins University Center of the Health Security. Other inventions are showing promise. Meanwhile, scientists are putting antivirus to the test to determine whether any might have what it takes to fight the coronavirus. For people who become very ill, they are using antivirals we currently use for other viral infections, and there is at least one experimental drug that was used in case that is sparking hope of wide use, Savage said. One such example are the antivirals already approved for HIV, lopinavir and ritonavir. Researchers are currently studying whether these drugs could be produced against the coronavirus. Early reports say patients with the new coronavirus in Thailand improved within 48 hours of receiving the HIV treatment in conjunction with the flu medication, alternative Tamiflu. A study from 2004 showed that the HIV drugs help people with severe acute respiratory syndrome and other coronavirus that break out in 2002 and improve their health outcomes. Now, scientists in China are studying whether the drugs will have the same effect on the Wuhan coronavirus as it did not SARS. Furthermore, an experimental antiviral known as remdesivir that's manufactured by Gilead Sciences has shown some promise in laboratory-based study against coronaviruses, and it will be important to conduct clinical trials to determine whether it is effective in patients with coronavirus infections, Adalja said. Remdesivir was given to the patient was Washington the first confirmed coronavirus case in the US. After given the antivirals, the patient's condition improved according to a new report detailing the case. The drug is still being tested as a coronavirus treatment and has yet to be licensed or approved. According to Savage, there are about 30 medications being developed by different companies. Because this novel coronavirus is in the same family as the recent new infections MERS and SARS, scientists can use the work they have been doing for those infections to apply to 2019 coronavirus, Savage said. The medications will need to be studied and analyzed further before becoming a standard treatment. The road to recovery. Some news organizations are reporting that the coronavirus death rate is much higher than the recovery rate, but many health experts said statistics is misleading. Complete recovery from respiratory illnesses of any sort, including coronaviruses, can take weeks to months. Scientists are still nailing down the infection's trajectory. This makes it tricky to have an accurate recovery rate. With any new infection, when we do not yet know how long it will take for the virus to leave our system completely, once a single person has died, the death rate can be higher than the recovery rate. Adalda agrees. He notes there are other ways of classifying whether someone has recovered or not. It is important to note that the definition of recovery used in the data from China includes being without fever for a number of days. It is not really a valid way to determine whether someone is recovered, as an absence of fever for a short period of time may be sufficient, Adalda said. A better measure would be to track the number of people who are expected to survive with minimal to no ongoing complications, Savo explains. Savo says it is important to realize that most viruses do not have a cure. With viral infection, the goal is avoid contracting them in the first place. Vaccines help when they are available, but proper hygiene, including frequent hand washing, avoiding contact with sick people, and cleaning infected surfaces, remain our best line for protection against harmful viruses like the new coronavirus. Because there is no FDA approved targeted treatment against the new coronavirus, people who have contracted the new coronavirus are treated with supportive care. Supportive care treats the symptoms: fever, cough, vomiting, diarrhea, fatigue, not the virus itself. It helps keep people comfortable while their bodies fight off the infection. Thanks for watching.